Hi, welcome back to our series At Home with Experts, and today I feel very lucky to have with me Dr. John Draper, who runs our National Suicide Lifeline. I really appreciate you being here, John.
Be here.
Great. First of all, I hope you and your loved ones are all safe and healthy at this point.
Well, you know, everyone has their story. So I'm not going to spend the next hour giving you my story, but it has been quite an adventure. I would say, and this is, you know, something to note, that I did have COVID, and actually our whole family got it in March. Because I'm here in New York City.
Yes.
And that we were, you know, part of the epicenter and certainly infected. I was fortunate enough to not really have many symptoms, or none of us really had many at all. We got through it pretty well. I did lose my sense of taste for a period, but arguably people have said I've never had much taste anyway.
Well, anyhow, I'm glad that that you and your family, you know, did okay with it, because I know you're at the epicenter, but I wondered about being in New York and all of that. We're hit so hard. In terms of the Lifeline, I've also heard that calls have really gone up. Has that been your experience?
There's been a lot of information and misinformation around that. So the interesting story at first is that for the first couple of months, we actually had fewer calls than we did. There's a lot of reasons for that. It wasn't because fewer people were distressed. It was because their marketing affects hotlines a great deal. People phone a number that they're aware of, that they see, that people say, you should call this number. So what was being marketed in the first 2 months of the pandemic were quite a number of lines, helplines, while people were sheltering at home. FEMA was supporting a lot of states and local and counties that were promoting their lines more heavily because they knew people were at home and adjusting to this crisis, and many of them were struggling. So Lifeline, which typically is the number that many people would see in this time, was supplanted by the marketing of all the other lines, including the Disaster Distress Helpline, which is also operated by our organization. It's a SAMHSA-funded service that is really designed explicitly for promoting for human-caused and natural disasters, people who were in emotional distress. And this kind of is somewhere in between. That was, and actually we saw about a tenfold increase in the Disaster Distress Helpline calls. But that was, again, and that also got a lot of press. And that's where a lot of people were saying, wow, look at there's so much distress. Well, in fact, that was a low volume line that was getting about 50 calls a day, and then got like 500 calls a day. So the way in which people talk about numbers, we have to be very careful of. But what is true now is we are seeing calls trending up. We don't know to what degree the higher than last year numbers are indicative of the kind of call volume increases we see every year, or is it extraordinary and unique due to this crisis? Time will tell. But I'm sure that's a question I'll be answering with greater accuracy and more certainty in the next couple of months.
What kind of calls are you guys getting at this point? Are there a lot of calls that refer to the pandemic in any way? I mean, just in terms of, I'm thinking about the things that have come with the pandemic, like joblessness, isolation, loneliness, you know.
Lisa, it's just a part of everybody's life now. And so whenever you're phoning the Lifeline or any helpline, it's going to enter into the conversation. It's going to influence the degree in which people are feeling and reporting stress. So we've been hearing a lot of anxiety, which I would say probably more than anything, we're hearing anxiety-related calls. People who are afraid and worried that they're going to be infected, or they're afraid or worried about loved ones, people they care about who've been infected and what's going to happen to them, or worried about their job or financial situation. There's certainly feelings of loss. People are, not only have they lost a loved one, in some cases, but loss of events and engagements and source and community connections that they otherwise would, whether it's a high school graduation, or it's a wedding, or it's a funeral. There's all sorts of things that that are signals of coming together that we are not able to really observe in the kind of way we once were able to. And so that sense of loss, on top of the rest of life going on, anything that bad happens in this environment can have kind of a multiplying effect.
Mm-hmm. Absolutely, absolutely. Are you finding that there's any change in who's calling, or those kinds of things, or is it pretty much the same demographic? Or
well, we haven't seen a lot of changes in that regard. But again, I haven't seen the most recent collection of data, and we'll get that soon, and I'll take a look at that. And there may be changes. I can say that one of the things that's really interesting is the CDC is reporting on the National Center for Health Statistics. They do this thing called the Pulse Survey, which I wasn't aware of was something that's done every week, and it's been done every week for the last few years. And they ask in that survey, through it's a web-based survey, how anxious or depressed people are feeling. They ask just 2 questions for each one of those areas. And what they found is that in the last 6 to 8 weeks, the number of people reporting anxiety-related symptoms are 4 times higher than last year at the same time, and depression-related symptoms nearly 4 times. And what that means is nearly 1 out of every 3 people right now are talking about anxiety-related issues. 1 out of every 4 people are talking about losses and feelings of sadness and depressive-like symptoms. And the group that's most affected by this, the group that's reporting the highest number of anxiety symptoms, depression, are younger folks between 18 to 29,
mm-hmm.
and between 30 to 39. The highest is 18 to 29. And so this is, and we're talking, about over 40% of people 18 to 29, close to 50%, who have been reporting symptoms of anxiety.
Yeah, that's really high. I've seen for the people that I work with that have anxiety that it's gotten higher, and especially for people with OCD type of issues, where now all the things to worry about. I mean, we're now being told by health experts that we should be washing our hands obsessively, that we should be isolating, and or people who worry about medical things and have that as one of their obsessions. Now it's every little thing that happens, maybe I have COVID.
It's really, I'm also a therapist, so it's really interesting to see, in the early, and there are different phases of this, and perhaps you're also, and I can talk a lot more about that in a little bit, but just in general, just with my clients at first, in the earlier phases, one of the things that I was noting is that those who have had a long history of anxiety at first, some of them were saying, now all of their friends were feeling anxious too. And it's like, well, welcome to my world. Let me show you how to deal with anxiety. And I thought that was kind of remarkable to see. These are people who were actually pretty well prepared. They've been living their lives this way for so long. Mm-hmm. But those are the early phases. And I think one of the things that we're not talking about a lot, we're talking about pre-existing health conditions and how COVID-19 affects that. But how does this pandemic affect pre-existing mental health conditions? And I think when you throw on top of this enduring, ongoing level lack of control and uncertainty, that those kinds of stressors, on top of losses and social fragmentation, disconnection from others. I don't have people there to comfort me, and I've lost things. I've lost connection. I've lost, finances or job. you throw all of that on top of a pre-existing anxiety condition or depression, it can be really, really challenging.
Yeah, and that's what I have seen for people. Yeah, I actually work with somebody who was in New York when this started, and wouldn't leave his apartment for months, was just by himself. So it's really a lot of isolation for somebody who already has a tendency towards depression and anxiety.
Yeah, I think it's going to be interesting to see. There's some people who were what known who are kind of asocial, who tend to be isolated to begin with, who at first, again, this, no change in their lifestyle. And some of them, kind of have a very suspicious view of the world to begin with, and fears that others are going to hurt them, or this is not a safe place to be in. And persons who are kind of that end of the spectrum, this is only confirming that worldview. And I do wonder, as the pandemic recedes and people do begin to re-engage in the community, how individuals along, kind of in that spectrum are going to adjust.
Yeah, I think for the person I work with who sort of falls into that category, he, first it was like, now everybody's isolated like I am. And it did make him feel better at first, but it's wearing thin now. And he was able to work at home from at first, and now is having to look for work from home, and that's a lot harder, obviously, because we're still in kind of lockdown mode here in California at the moment, because we've had our peak, hopefully, because numbers went down a little bit a couple days, but maybe, we're really sort of experiencing more what New York was experiencing at the beginning.
It's one of the, we're also pretty engaged in the world of disaster mental health. Our organization was thrust in the middle of it when we were running a hotline for 9/11 back in New York City during 9/11, and it became kind of the central resource for the response, the mental health response, the largest mental health response in the nation's history, actually. There was hundreds of millions of dollars that poured into New York City, and to deal with what many people thought was the biggest mental health catastrophe in our nation's history. And so we were kind of thrust in the middle of that, and then without having any experience at all, we became engaged in this for about 5 years, and then since then have been running the Lifeline, which was involved with Katrina, and then later with a number of other hurricanes, mass shootings, and running a disaster distress helpline. So the area of disaster mental health is something that we've been kind of living with for years, and there's a phases of recovery after disasters that some are instructive for this pandemic, and some aspects of it are very unique. But the things that are kind of interesting and similar are there's the first phase of a disaster is what we call the heroic phase. So it's when something happens and the first responders, people who are engaged on the front lines, are really properly celebrated and appreciated. And certainly after this, at the beginning of this, we saw our healthcare workers really celebrated, and they were treated like we treated, for example, firefighters and police in the early days of 9/11. Of course, the difference between healthcare workers and firefighters and police is healthcare workers didn't sign up for this. They didn't sign up to put their lives in danger where they could become infected. Police and firefighters did sign up for that.
Yeah.
And healthcare workers came in with the idea that I'm gonna save lives, and most of the time I'm gonna do that. But many of them were thrust into a situation where there wasn't anything they could do. They were confronted with vast numbers of individuals without the supplies and equipment and treatment capabilities to make a difference, and then had to also be the ones who told the families. So it was an incredibly challenging and difficult thing for these first responders. They've all had their own, challenges in these post-heroic phases. Mm-hmm. But initially, we are celebrated, and then after that comes this kind of honeymoon phase where there's a lot of coming together in the community, where people just say, hey, we're all in this together. We're all suffering, we're all rebuilding, we're all doing whatever we can to get through this. We saw it in 9/11, we're certainly seeing it here, or did see it here for a while. But then it is replaced by this kind of disillusionment period, where the impact of this disaster is differential. Some people feel it more, some people feel it less, and the differences in experience become potentially divisive or create a sense of fragmented. How come you're not going through this and I am? How come you're not seeing it the same way I am? And so suddenly what was the coming together now starts to fall apart, and there's this kind of disillusionment period. Actually, come to think of what I'm describing, that heroic phase, the coming together phase, the disillusionment phase, sounds a lot like a marriage, actually. You kind of go through these phases, and then comes, after the disillusionment phase, the what's called the rebuilding phase or recovery phase, where where we all say, okay, we're past this, now we have to move forward, and we're going to be reckoning our losses, adjusting to our losses, and rebuilding that which must continue to go on, and perhaps take our lessons learned to be stronger. We're not there yet, and this is what makes this really different, is that it's not a single catastrophe like a terrorist attack or a hurricane. It's enduring, it's invisible, and it could recur. And those are things that kind of keep you off balance, and a sense of uncertainty and lack of control that can be maddening for many people. So the ability to kind of move through these phases in this way that we've seen in disaster mental health for ages, we are in really uncharted territory.
Yeah, there's so much uncertainty. When something like that happens, a tragic event, that's a one-time event, it ends already. And then, right, that part of the uncertainty is over. How you're going to cope is still to be found. But, in this situation, the uncertainty isn't over. Yeah. There is no particular end date in sight even that we can see or know. When will it be safe to go back to, quotes, life like it used to be, if ever, is really still up in the air. So, that seems like the one, like you said, it's a major difference in this kind of situation.
It is. And when we talk about reopening, and reopening, for the economy and that sort of thing, as desirable as all that is, it's completely ignorant of mental health processes, which is, we've got to reopen our minds. When we've been told, be afraid, wear masks, just being in the presence of others could hurt you. And this is, I'm a very trusting individual. I've gone through my life, enjoying being around people. But it's a very strange experience for me, and I know for others, to be walking, to see a crowd and be frightened of it, especially for those of us in New York City, who are accustomed to crowds. Yeah. But to say, whoa, and also, seeing people cast judgments on one another, just simply because they're either wearing a mask or not. And I mean, those are real experiences of about the judgments people are making about one another. that are, you know, absolutely about threat. This person, this situation is threatening to me in ways that we never would have told ourselves before, unless we, you know, again had a suspicious nature. So it's a you know, getting us back into that place where we are engaging others in a way that's very open and caring, is going to be an interesting challenge.
It is. You know, I'm also a person who tends to like people, but now it's kind of like, oh, wait, are they too close? You know, it's like, what an odd thing. And I see it with, I have young nephews, one who's only 2 years old, and he's learned, you know, oh, is that somebody I can go near or somebody I can't? And his first reaction is this, where he's such an outgoing person, you know, and, you know, it's just, and then, you know, his parents have moved in and out of our quarantine bubble, and, you know, can he come near us or can't he? And the transition's always a little rough. Then he gets used to it and he's back to being, you know, himself. But I see that it's going to be really hard.
And so many families and friends. I mean, so that's also a very interesting dynamic. I think everybody, there's different levels of risk tolerance among friends and family. There's different levels of vulnerability among you know, friends and family. There's different, you know, levels of exposure that people have been, you know, so balancing all of that, or juggling all of that with the need to be with people that you care about is really a calculus that we've never really had to address before.
Yeah, no, I have elderly family members that are more frail, and so, you know, we're being super careful, but that's, you know, because, so my risk tolerance has gotten very low.
Yeah.
But, you know, I see people in my family who want to have a higher risk tolerance, and, you know, it's just, it's interesting, you know, you know, having to negotiate those
Yes.
differences. And yeah, that's not something that we ever quite thought about in that
Well,
same
it
way.
creates tension. I mean, it definitely creates, you know, conflict, sadness, anxiety, interpersonally, that we just, you know, aren't accustomed to feeling with each other.
Right. And I think, you know, for some in our population, it leads to such isolation because they want to be with family, and especially some of those who are most vulnerable, but they have, you know, and they may have limited time because of their age or whatever, or health conditions. And yet, you know, is it worth the risk? You know, and so I just could see all those, you know, it's a very odd thing that it's doing to us with the people closest to us, let alone people we might want to meet but are staying away from.
Yeah, and I think, you know, there's a few things that we know also in disaster mental health that are really crucial for people, to keep them grounded and resilient. And I mean, I like to refer to what we're going through as not a recovery, but a success, but we're trying to successfully endure it. We're not recovering from something. We just have to endure it and get through it successfully. And I think, you know, there's a couple lessons again from disaster mental health research that says the two things that are most important in helping anybody get through a major crisis, catastrophic event, are routines and social supports. Now, routines, if you can imagine when your life has been turned upside down, and it's easy for us to imagine that now, that when everything is uncertain and seems a little nuts and out of your control, what's within your control and what is certain are your routines, the things that feel familiar, that can help you stay in the present, so you're not focused on the things that are outside of your control or uncertain, which is the future. So stay in the present, and routines are very helpful in helping you do that. What do I have to do today? And kind of the familiar, and staying attached to the familiar, as opposed to all the things that are going to be unfamiliar, that you have no idea, you know, what's going to change today. So what's not going to change today is the time I eat, the time I go to sleep, the time I do my exercise. Or if it does, it's going to be because I'm going to choose to do it at this time today, but I have a routine in general that grounds me. So that's really important when life's being turned upside down and you have a lot of other things you have to adjust to. The other thing that again is around social supports, and this is what is, I think, such a challenge for us now, is that the way in which we engage people socially is different, and often fraught with challenges that we're not accustomed to. But the ways, and I don't know about you. I mean, have you? Here we are, speaking virtually,
Right.
and we've talked on the phone before, and we've done a webinar before, and this is a little different. We haven't done a panel. I've done more virtual panels in the last few months than I've done my entire life, and I've had more virtual conversations with people, using Zoom than I ever imagined. And what has been your experience of the virtual connection? Are you feeling are you surprised by the quality of that, or sort of the quantity of it is one thing, but how's it felt?
The quantity. I've always had a mixed practice. I've seen people in person predominantly, but I've also seen people remotely from other places, or I've had clients that travel a lot.
Right.
So I was doing some before, but this is really different for all of my patients to be virtual. And, it is really different. At first, I had a lot of trepidation about it, but it has gone fairly well. And when somebody is not well, it feels a lot safer to not be in the same room with them, I have to say. But I feel like it's also in some ways more intense. You're totally focused on that person's face, pretty much. A little bit of body language, but not a lot.
Right.
And it's kind of in some ways intensified things, I think. And it certainly has allowed me to stay connected to all of the people that I was working with, and even start with some new people, which wouldn't have been something I could do during this time. And the routine of having work for me has been really important, so having a structure to my days, we try to take a hike early in the morning with our dogs. I live on a ranch, so we have some property. We can do that without running into anybody, and to do some, basic things like that give it structure. Because I think what I found is people were staying up way later, getting up later than maybe, something they had to do the next day that, so their schedules were all over the place. And that I think made people feel more discombobulated by the situation. And I do think the routine thing is really important. So having that back in place feels good. I've done much more virtual presenting for conferences that ended up going virtual than I ever thought I would. But, and I've been doing, because California requires now suicide training for all therapists, I've been doing a lot of those trainings in person, as well as having one available online, but I've been doing those online for groups now.
How have you, aside from the obvious convenience of it, but how have you felt the quality of these engagements have been virtually?
The therapy relationship part has gone pretty well. But once at conferences, what I miss is all the connecting with your friends at conferences, and the exchange of ideas that happens in those times. If we meet and end up having a cup of coffee at a conference, we have ideas. I talk to you, I learn things, it influences things, and those collaborations, that part, I feel like has been lacking. I feel it some from these conversations we've been doing this series, because now it feels like we're sitting down and have a cup of coffee and having a conversation. You know what I mean? But I really have felt that's one part that I have really missed. And it's hard to pay attention for hours on end to Zoom conference all day. I found that really difficult. Whereas if I'm in the room and also having those personal exchanges in the little 15-minute breaks and coming back and sitting, I can take in a lot more. So yeah, it is different and not ideal.
Yeah, I think in those settings like conferences and the office, there's Unquestionably, there's, evidence pretty strong about how productive you can be working remotely. But just like you were talking about conferences where you have those kind of off-the-cuff encounters that are totally serendipitous, that you suddenly hear something that makes you laugh or something that makes you think, or an idea that causes you to have a conversation that you would never have had that might actually lead to another opportunity. Those things don't show up in terms of productivity, but they sure show up in terms of morale, in terms of feeling like you belong at a place of work, and ultimately can help you sleep better. But those are, and also certainly at conferences, or committee meetings or anything like that, where I very much miss those. It's one thing to have just the discussion that you wanted to have, but to have the discussions that you had no idea were going to happen, that's, what makes developing a sense of community really wonderful. And it's just like when you, in a small town or your the place where you live, just walking down the street having a conversation that you never would have had otherwise. I think those are the kinds of things that we are missing. The virtual things are still very meaningful because we can still have very intimate conversations with people, certainly one-on-one. And we can virtually, in conferences or settings like this, we can reach a lot of people, hopefully with just having an intimate conversation. But it does have a linear quality to it as opposed to a kind of a unidirectional thing, as opposed to this very dynamic, anything can happen, and that's what socializing exciting.
Right. And in terms of work, I've heard of a lot of companies were moving towards trying to make it so people had more what they called collisions, where people would run into each other, because that's how ideas would generate, and things would start, and a lot of creativity, and so they tried to set up situations for that to happen. Wherein this is like you're saying, it kind of puts the brakes on those spontaneous bumping into the person you might not have thought you were going to talk to that day, kind of thing. And so I do feel the missing of that and the casual contact with others without having to think too much.
And Lisa, you mentioned your clients, and I have to say that this telemental health thing that has now had to happen because it's the only way it could happen, I really hope becomes a real thing, and a legacy of this pandemic. There's quite a number of people who have difficulty getting to therapy. It's not, and there's certainly people in rural areas who have that difficulty, but just being depressed and getting out of bed. It's easier to get to your computer than it is to get in your car or get on the subway or get in a cab, or why making it easier for people to connect when they're having troubles is what our system should be doing. It should be built around the convenience of the person who's suffering, not the person who's providing. And it is right now built around us providers. So my hope is that this is going to create open doors for people and providers. And you were saying about some of your experiences, some better than others. Mine might have been very good, but and haven't felt terribly different. But I've talked with people who've never done it before, and I've also done remote therapy because I have a lot of clients. LA and New York, your clients travel. So, So I've talked to people who just never done it, and they just thought it was a terrible idea and just didn't think it could work. And they were saying, wow, we've had some breakthroughs that I just never thought would occur. And I think another thing we underestimate, Lisa, is that when they come to see us, people are coming to our office, they're coming to our place, which they may or may not feel comfortable in. In some cases, it might be great because it's a neutral setting. But the advantage of them being in their home is it's a place where they feel safe and comfortable. And also things can happen in their home suddenly that can remind them. I can just come out, he just came out of the kitchen with after having an argument. Or, there's something in vivo that happens in the world where they're from, and they're talking to you about it. I used to work on a mobile crisis team, and I would go to people's homes. I did that for 7 years, and that was the most remarkable experience of my life as a therapist or a counselor, is going into people's lives. And so we're a little bit closer by being there in their home with them through this virtual setting.
Yeah, no, I used to do that kind of work too, working for a school, but we would, for kids who had special needs, and we would go and do home visits, and you would get the context, that you don't get when people just come to your office.
Right.
And it really makes a big difference, to go into their worlds. And in a way, we're doing that now. And we're able to be consistent in a way with people who travel or do other things, or who aren't always available to come to our office. People have health conditions sometimes as well, even in the past that would get in the way. So, I think that's like you said, I think a really good thing that I do hope remains. And I also think, especially for clients who need specific services, that it would allow them to access the experts they need from home and across boundaries. That person might not live in your area who's the absolute best to treat you, but wouldn't that be great if that person could do it anyways, remotely? So I think, that's one thing that would be an advantage. And
Lisa, my daughter, she has this great psychiatrist who, just started with, and she, if she had gone back to school, where she was, her psychiatrist would have had to stop seeing her, which is nuts. I mean, that just, that relationship that now some psychiatrists will say, yeah, I'll do that, but some are fairly strict about that and say, no, I mean, there's concerns about that. I'm not allowed to do that for various reasons. And so we've got to give providers the permission to be there in the way, and she wanted to be there, the psychiatrist, but she's like, I'm just not allowed to be. These are ridiculous barriers that our system has put up. Insurance companies, perhaps some of the trade associations who've said, no, it's about relationships. It's not about state boundaries.
Relationships, yeah, it is. And what a difference for somebody to be with the same person which they've already built trust, yes, who is consistent in their care, who isn't saying, oh, I don't know why that person did this, I'm going to do this different thing, yeah. And kids being home from college has been a really interesting experience and very positive one for people in my family too, nieces, nephews who are home. But it's really interesting, it's allowed some things to happen relationally that wouldn't have happened otherwise. And I think that's really important.
It's an interest. It's really, you see all sides of it. I've definitely talked with people who, like, it's just been, years from now, we'll be looking back on the pandemic as like, those were some amazing moments that we shared in the home together. Others, that was the worst time of my life. And like, I couldn't get out. I mean, some are saying that divorce rates are going to go up, but others are like, this is the pace and the level of engagement that I've always I didn't even know was possible still in this fast-paced world.
Yeah.
So it is, I think, for some people, it has put into perspective by slowing the pace and changing the routine. I'm in Brooklyn, so you can hear but
that's okay.
Yeah, but by slowing the pace, it gets people to really engage their life in a way that could, in some ways, be more meaningful by the relationships they're in.
Absolutely. Yeah, and that's so important. What do you think that are some warning signs that somebody may be getting into trouble during this time that people should look for in their friends and family? Or
Oh boy, you know that, and first of all, it's just so good to be staying in contact with people if you can. I mean, uh, there are, you know, lists that we should keep in our head, if not on paper, of people that we want to stay in contact with for different reasons. There's some that, you know, we're worried about, we want to make sure that we check on. And there's others that, that, you know, just help us feel, you know, good and connected. And we need to do that for ourselves so we can be there for others too. So, you know, making sure that we're staying connected with people who are worried about it. And some of the things that you don't know if you're not with them, you're not seeing them. So it's there's a few ways to do it. As you notice changes in how they're connecting and when they connect and or disconnected or they're not responding. And certainly when you do talk with them, if they're talking about, I always make a point of asking directly how they're doing and what they're doing to take care of themselves right now. If anything's changed. I can be self-disclosive too. It's really important that, we talk about, how we're also struggling in whatever ways we are. So it gives them permission to do so. And certainly the people I care about, I'm very open with, expect them to be open with me. So being, disclosive and open about wanting to hear genuinely how they're doing.
Yeah.
Not just as a quick checkbox sort of question. Let it be a conversation, and then have talk with them about what has been helpful for them in getting through it, and also how you might be helpful, and how they've got through these kinds of things in the past where they've had to struggle with changes in their life. And no one's struggled with the pandemic before, so that's not the how do how have you dealt with pandemics in the past? It's not really a question.
Whoever thought there'd be one in our lifetime?
Well, I mean, I remember, again, when 9/11 happened, I was there was this amazing campaign, public mental health campaign that went on here, because I remember feeling this way, and people saying, "How are you dealing?" And certainly I was, I had a different calculus in terms of safety in my life, much like we have now, which is, what's going to keep me safe? When's the next terrorist attack going to come? We just didn't know. And so, people say, well, how are you dealing with it? And what I realized is that, well, gosh, the way I deal with anxiety, the way I'll deal with it here, it's anxiety. It's not, no one taught me how to deal with anxiety about terrorism. They didn't teach me to deal with anxiety. And this campaign that was done here in New York City, which was amazing, it was on the subways, it was on the buses, it was on telephone booths when they had that back then. It was everywhere. And what they were just simply little stories that they captured of what people are doing to deal with, to cope right now. And the little stories were, got on my bike and rode a couple of miles and came home and played with my kids and had dinner with them. That was it. That was the campaign, to remind people that it's, focusing on the big issue is not what you need to do. You need to focus on the here and now and what's within your control. And so that is what, I remind myself, and I certainly remind folks that I care about. So, what can you do now in your life that will help you feel a little better? And there's, at least there's a lot of different things that that we can do. And this is a very reflective time. I mean, because things are, you can reflect on all aspects of your well-being. So, you can certainly, my social well-being is one thing I can think about, and who's important in my life and how do I stay connected. My physical well-being, how about my diet, my sleep, my exercise? This is a really good time to be really focused on that. I can really take care of myself now. And what about my intellectual well-being? You know, how am I growing? What am I learning? What would I like to engage in that would help me feel like I'm you know, perhaps being more creative or thoughtful in certain areas that I hadn't been before. What am I reading? What am I watching? What am I learning from others? There's also our spiritual well-being. What are we, you know, how are we engaged with things that are larger than our own lives? You know, what gives us meaning in this world? You know, what are we giving to and believing in? And there's a lot of social movements right now in a way that are extremely enlivening and hopeful, as well as our faiths or you know, whatever it is that we observe to help us connect to something very spiritual. And there's our, you know, occupational well-being too. That, you know, what are we doing if we're out of a job? What are we doing to, you know, look for look for a new job or develop skills that might help us, you know, with our prospective job in the future? Or what are we doing within our field right now that we could be doing a little differently or better? So there's always things that, you know, so what can I do within my control that, and so those are the questions I will ask, you know, myself, my friends, and really anybody that I care about, so they can kind of get some perspective on away from all the things they can't control and are uncertain about, and back into their lives to something they actually can make a difference with.
Yeah, I think that's so important. You know, it's how can you develop in any of those areas during this time instead of just seeing it as kind of my life's on pause, because it's getting too long for a pause button, you know.
Right.
That was over in about a week or two.
Yeah, that's a good point. Yeah, it's the only, you know, the only fear that is actually being reduced right now is the fear of missing out. Nobody's doing anything. So you've got some things that you can do in your life that you're actually missing out on if you don't pay attention to.
Yeah, if you don't pay attention to them, I think that's so important. And I think what you said about routines that are grounding was so important too, because, you know, that does make us feel more like, okay, this is what I can't control. I can get up at this time. I can do these activities that I know are good for me. I can engage in my work for whatever period of time. I can stop working at some point too. Just because I'm doing it electronically doesn't mean I have to do it all the time.
Right.
You know, because people get lost on that end too.
Yeah, and hopefully, you know, you're living with or being contacted by others who are reminding you that, oh, by the way, there's other things in your life, you know, that you should be doing too.
Yeah, and that is the advantage of having a family to do that. But, you know, and some people are more alone and don't have that. So I know people are on everywhere on that spectrum. But I'm glad your family got through your struggle with this.
Yeah. No, we certainly, you know, there's a lot of people in our lives that have been very much affected, and we've had some losses in our lives, you know, all of us. You know, I lost my mother just a couple of months ago. Who was in a memory care facility in Houston, and I couldn't get to the funeral. I could get to the funeral, but that was a virtual funeral.
Yeah.
And so it was just kind of a reminder of, you know, how you have the way of being there for people and gatherings that are meaningful. We've got to find ways to make them meaningful without actually gathering. That was a real, you know, odd social experiment, but it was still very meaningful for me and my family.
Yeah, I'm glad to hear that. I'm sorry for your loss, though, too. And this is a rough time for people who have family members who are sick because they can't even be there. You know, not even if their family member doesn't have COVID, if they're in the hospital, it's not like you could be there.
Exactly.
So I've had a couple of friends who've lost people during this time, and it's just hard because they couldn't be where they wanted to be, you know. And I think, you know, at least doing those things virtually, even though it does feel kind of like this weird social experiment, it feels a lot better than not doing it at all, you know.
It does, and you know, one of the things that you know, that I felt was really interesting. That the question of, should we wait to have the funeral, a year from now, a year and a half from now, where we could all get together, and that just seemed untenable. I mean, it was in Houston, which is like in the middle of an epidemic or pandemic. It was the epicenter at that time. So doing it there, my gosh, that seemed like really ill-advised, to fly all the way to Houston, to not really be together, but to have this ceremony. But we had committed to doing it and decided to do it. And in retrospect, I'm so glad we did. And one of the reasons that it was so, I think, really poignant for me is that, the word closure is not, I mean, from working with loss survivors, there's certain things. Closure is just not a, it's just not the right word. But what is the right word is for me, or at least, or phrase is, how are you going to carry the memory with you? And for me, going there and being forced to, give a eulogy, to put my thoughts and feelings in a cogent way that I can talk about this person who meant so much to me in my life. The process of doing that allowed me to then carry her with me, which I do every day, because I have a story that I've told about, and that feels coherent to me, that I've told others, that now and that story is for me. I mean, yeah, it's for her too, and it's for others to remember her. It was really for me, and it was a story I told about my relationship with her, that now I have that resonating with me. And so that allows me, it's not closure, but it allows me to carry her story and write new chapters with it in my life.
Yeah, no, I appreciate that. We had a friend die very suddenly right before this pandemic, but it was the week that things first shut down in California that we were going to have the ceremony that we were going to do. And we didn't because we couldn't at that point. But I think that would be a way that we could do something. I was just thinking about it this morning, actually. So thank you for that. And somebody I have a lot of stories about, because he was like a big brother to me. We lived next door to each other for our childhoods, and I was the oldest in my family. I didn't have a big brother, so he was that for me. And it just was really sad, and it was really sudden. And anyhow, telling those stories, I think, would be important, to be able to carry that in a way that, and communicate that to others. I think that's the important part, because like you said, closure is not even the right word exactly.
You don't want that. You don't want to close the chapter on somebody you cared about. I mean, their life had meaning. What is it to you? And how are you going to carry that meaning?
Yeah, I like that a lot. Anyhow, thanks so much for that, John, and for everything. I really appreciate the conversation.
Oh, my pleasure. It's always good to talk with you, even virtually.
Even virtually. And I didn't even know that you had done all this stuff in disaster mental health after 9/11.
Oh, yeah. We're still doing it, as you know, right now. It's suicide prevention. It's population mental health. It's like, how do we help as many people as we can? And I'm hoping that this conversation was helpful to a few people.
Me too. Thanks so much, John, and I think it will. And I liked your story also about the campaign of putting up people's stories of what they're doing. And I think we need to focus on more news like that.
Yeah.
That reminds people to live, not to feel down about what's happening and helpless.
It was amazing. It was like holding up a mirror on subways and buses of, oh, that's my life that I need to get back to up there.
You need to do that. Yeah, I can do that.
Yeah, saying, where's the next bomb going to drop, or whatever. Oh, there's me in my life. That's what I do.
Yeah, I think that's so important.
All the best to you and your loved ones, and to those watching this too.
Okay, bye-bye.
Bye-bye.